Welcome to ICD-10 Swiftly Transition and Reap the Benefits. I want to thank you all for joining our workshop today. The transition from ICD-9 to ICD-10 is right around the corner, and I know many of you have been busy preparing and training. Today we're going to learn the positive impact about what this change can have as you manage populations and strive to improve the quality of care that you deliver. We're also going to see how i2i tracks can help you achieve rapid ICD-10 transition success. I'm Nancy Thompson. I'm the Director of Education for i2i Systems, and my co-presenter today is Shannon Nielson. Shannon has deep experience in leading organizations through practice transformation processes, including patient-centered medical home, meaningful use, accountable care organizations, and now ICD-10 transition. Shannon has served as interim COO, quality director, and other operational roles for organizations undergoing this practice transformation. Currently, Shannon serves as the interim CEO and vice president of consulting services at Centerprise. Before we begin, please note that today's webinar is being recorded and will be made available for download after today. Just check your email for more information. We will take your questions at the end, but you are always welcome to submit your question through the GoToMeeting panel on your screen. Now I'm going to go ahead and turn the presentation over to Shannon. So Shannon, go ahead.
Thank you, Nancy, and thank you everyone for taking some time out of your day. For the next about 15 or so, that was 1-5, not 5-0, but for the next 15 minutes or so, I'm just going to kind of walk you through, as Nancy said, the positives, if you believe that there is one, of this transition to ICD-10 that we will all experience later this week. So over the past year, we've spent a lot of time, probably 2 years, spent a lot of time training our providers, talking about what this means in terms of billing and how we could see a slowdown in our revenue. So things have not sounded really all that great. A lot of the work that I do is around quality and improving your operations and making sure that we can actually deliver on accountable care. And I'm here to give you the message that ICD-10 will actually help us do just that. So accountable care is our actual ultimate end goal in all the transformation work that we're doing within our practices. It is the ultimate goal of accountable care is that we're reducing total cost of care and we're improving the quality outcomes, and we've all heard that a million times. So accountable care is our actual end game. Population health management is actually defined as the interventions that are implemented to result in our ability to deliver accountable care. And ICD-10 actually has a role within population health management. So ICD-10 provides us with the tool by which we measure the impact of the interventions we're choosing to manage our populations. So why didn't ICD-9 play a role for us in population health management and delivering upon accountable care? That's actually what we're going to address today, is that difference from ICD-9 to ICD-10 and how ICD-10 is actually serving its purpose. It's serving as one of the population health management interventions that will ultimately allow us to deliver on accountable care. So currently in the population health environment, we're collecting data from many different sources. And the data that we receive from these sources are actually necessary to help us choose our appropriate interventions, which will maximize the health of our population. So again, population health management are the actual interventions that we choose that should manage the health of our population. So we're looking at payer enrollment data. It's always good to know who our patients, our panel of patients are from managed care organizations, whether we're seeing them or not. Any community needs data, what's going on within the community, our internal specific practice level data, our data around the specialties and from our specialty physicians, of course claims data, which plays an essential role, a critical role within accountable care as a whole, and then hospital level data, urgent care data, some of the community agency data. So when we take all of the information provided by, that we have access to within the community and internally, we're actually able to best determine what interventions we put in place to manage the overall health of our population. Nancy, you can go on to the next slide. Thanks. The interventions that we choose based on the data we just looked at should result in a decrease of total cost of care and an improvement in our clinical outcomes. So that is accountable care. So the degree to which we are able to impact the cost of care and the clinical outcomes is heavily dependent on the data that we receive within population health. So ICD-10 will actually provide us with a tool to measure the impact we have on the cost of care and clinical outcomes. Nancy, you can go to the next one, please. Thank you. So why ICD-10 right now? So as I just said, ICD-10 will play a role, and we'll kind of go through how on impacting the total overall cost of care as well as the improvement within clinical outcomes. If you've worked with me before or done a lot of process improvement work or QI work, you've heard of the term SMART goals. And what that refers to is whenever we set goals within our organization, they should be measurable, specific, achievable, results focused, and time focused. So we're going to use the same acronym to help explain why ICD-10 is better than ICD-9 as we transition to an accountable care environment. So ICD-10 provides us with more detail within our coding to help us measure our actual current clinical status of our patients. And we'll look at the anatomy of the ICD-10 code here in a minute, but the coding anatomy actually makes it measurable. The specificity is the most critical advantage to why ICD-10 will help us improve our quality of care more so than ICD-9 did, so the specificity. Achievable, and by achievable with ICD-10, what we mean here is we're able to further stratify our populations and identify our populations in a manner that allow us to set achievable goals. It's results focused, so it allows us to actually track outcomes and the impact that our interventions actually have on our outcomes, and it's not time zone bound. So the rest of the world, most of the rest of the world is actually using ICD-10, and we're one of the very latecomers to the table. So what we will now be able to do is actually look at quality and cost on an international level, which of course helps us for research purposes and global population health management. Comparatively, ICD-9 was measurable. We could measure how many of our patients had diabetes type 2 or how many was it specified for a certain reason or unspecified. But it really didn't provide us with the level of specificity that we need in order to truly measure the impact of population health management interventions and on cost and care. We were able to receive baseline population data, but not necessarily the subpopulation stratification of patients with certain conditions. So it did not, again, the specificity limited us from being able to further define our populations. And it was domestically time zone bound. So we really were only able to compare and do some research and monitor cost and quality based on patients, based on all the care delivered within the United States. It made it very difficult to compare the cost and quality of care on a global level, since the rest of the world was on ICD-10 and we were still on ICD-9. So what does this mean for you as a practice? So how can you now say, okay, that's great, you're telling me that ICD-10 can do all of this, but now what will this help me do within my practice? So first and foremost, the first thing that ICD-10 will allow you to do that is so critical, especially if you're a patient-centered medical home or are working within a clinically integrated network or some sort of accountable care environment, and that is to redefine risk. So due to the increased specificity within the anatomy of the ICD-10 code, we are now able to look at risk much more in depth and define the risk of our patient population even further. So this is perhaps the most critical component and the most essential benefit, or the most advantageous benefit that you will actually see from the transition to ICD-10. Next, we can identify who our high-cost patients are due to clinical condition specificity. So we make a lot of assumption in today's world because of the lack of accessible data or shared data between payers and specialists and primary care offices and hospitals and everybody else involved within the delivery of care. We make a lot of assumptions about who our high-cost patients are and what the current lab values or environmental factors that play into a clinical condition and how those impact cost. And the reason we make assumptions is because we don't have all the information embedded within our codes that we currently use. So with these ICD-10 codes, we will further be able to define and more accurately define who our high-cost patients are, because we're now specifying whether a condition is due to an environmental factor, or if a condition is due to a genetic factor, or due to an accident, or and if it was an accident, was it a motor vehicle accident? Was it a farming accident? Was it so? We're now able to identify truly where we're spending the most amount of dollars, and then next, further, which interventions work for what clinical interventions or for what clinical conditions. In addition to high cost, sorry about that, we can now actually determine which population health management interventions that we discussed on that very first slide about how we come up with our population health management interventions, which ones actually work for which clinical conditions. So we may find that a self-management tool that we implemented, or a piece of education, or a certain documentation methodology works better with patients who have mild, persistent asthma versus those that have severe, persistent asthma. So now we can actually start to tailor our interventions based on the specificity of the actual conditions that our patients have. We'll have improved data for research purposes. We can actually start to look at our public health risks. So, we are starting to code in the anatomy of this ICD-10 code. We're going to start coding environmental factors, age factors, clinical factors that we have normally not documented except for maybe in a free text field within our EMR. Now that documentation will actually be in a queryable code where we can then do some further research. And then lastly, due to the need for improved documentation and more detailed documentation from our providers so that we do get reimbursed with these ICD-10 codes and that we're coding appropriately, it should result in decreased fraud and abuse, which of course is absolutely critical this day and age. Okay, so let's take a quick look at the anatomy of the new code. I'm sure all of you have been through this. If you haven't, I would highly recommend you get some training done here in the next 24 hours. But the first 3 digits will explain the category, so diabetes, asthma, well child, pregnancy. It will actually define the category. Then next we look at the etiology, which is the cause of the condition or the cause of the category, the anatomical site, and the severity. And then if needed, we have an extra extension. So already much more detail than we had in the ICD-9 codes, with, in my opinion, those middle 3 digits providing us with all the information we need to be able to better monitor the quality and cost of care that we are delivering our patients. So very quickly, let's walk you through a couple different examples and why it makes it, why the change in code has an impact on our quality scores. So asthma. So as we all know, and if you are a federally qualified health center or a health center of some sort out there on the phone, then you well know we have no code for asthma. So in ICD-10, it was very difficult if the feds asked us to report on asthma. We were often doing a manual audit because just even wheezing and asthma both have the same code. So fortunately, in ICD-10, we are now able to look at we're able to document asthma in several different manners. And these are just a few of those examples. So a 493.9, which in ICD-10 was asthma unspecified, can now become one of several different codes that provide us with a bit more information. So we have unspecified asthma, uncomplicated, mild intermittent asthma, mild intermittent asthma, mild persistent asthma, cough variant asthma, and then we can add an additional code based on the documentation that we have exposure to tobacco smoke. So all of a sudden, today, I can't really give you any pertinent asthma information because I don't really know if somebody has asthma or for what reason, or if it's intermittent or if it's persistent. But on Thursday, when we go live on ICD-10, I can now explain to you that we have X percentage of patients who have asthma actually have mild intermittent asthma, and of those, X percent have exposure to tobacco smoke, and of those, I'm able to implement a certain intervention, and when I do that, I can now see the impact it has on the cost of care internally, as well as on their quality outcomes. Next, diabetes, similar example here. In ICD-10, we had to use multiple codes to explain the specificity or the reason for diabetes or any sort of co-condition with diabetes. And in ICD-10, we now have a 6-digit code that provides us with the exact same information. It's just one code that we're looking at. And lastly, we'll take a look at otitis media and bronchitis, and then I'll turn it over to Nancy. Otitis media, this is just a small sampling of the number of codes that we now have options for otitis media. However, for someone who does some surgeries around ear tubes or works with otitis media quite a bit, or if we're trying to find out if there's something going on in the community or the environment that may contribute to otitis media or bronchitis or another condition of that sort, we now have enough specificity within the ICD-10 code to be able to say what factors contribute to what clinical condition. So from a public health perspective, as well as a quality perspective and a cost perspective, these ICD-10 codes are actually going to provide us with an arsenal of information for us to deliver accountable care on a much larger scale than we currently are able to today. So with that note, I hope I gave it enough of a positive spin that everyone feels a little bit better going into Thursday. I don't know that anyone feels great, but start to ask yourself questions about interventions you put in place and how we can measure the impact that they're having on certain variants of diabetes or well child checks or OB services that we're providing. Those are really important questions that we need to ask so that we make sure that we're being cost efficient and time efficient within our own organizations, as well as on a more national and global scale as well. And with that, I will turn it over to Nancy to walk you through some things that I think i2i systems will be able to help you do during this conversion.
Great. Thank you so much, Shannon. That was really great, and it's always good to hear that positive impact on all of our work. So thank you very much. Well, you know, I've been talking with many of you over the past few months about ICD-10 and the challenges that you're all facing. And I know all of you have concerns about ICD-10 and the transition. Like, are your systems going to be compliant? Are your providers trained and can accurately code encounters? And how do you even know what codes are being used? Many of you are concerned about revenue implications and possibilities of loss of productivity, not to mention all of the required reports that now need to look at ICD-10s. And these are all very important concerns, and we hear loud and clear that you could really use some help. Despite all of the questions and concerns, there is some good news. With i2i, you really have a partner for this transition. We're going to address those concerns and more. And throughout this part of the presentation, you're going to see just what I mean by that. Our role in your ICD-10 transition is more than just making sure that i2i Tracks is ICD-10 compliant, although that part is vital. But as a population health management system, we also provide you with data and analytics tools so that you can make sure you know exactly what's going on at your organization, what codes are being used, who is developing proper coding habits. You're not going to have to wait until the end of the month or even until you start getting denials from your payers. You're going to know how you are doing right from the beginning. So during this part of the webinar, we're going to explore ICD-10 in Tracks. We're going to look at i2i Tracks ICD-10 data. We're going to look at preparing for compliance. And we're going to look at our daily monitoring tools that will help you during this transitional phase as we all strive to achieve the perfect 10. So let's start with the first piece of the puzzle and quickly talk about i2i Tracks ICD-10 data. i2i Tracks unlocks the data in your EHR to provide visibility and transparency of your coding practices, which may be otherwise hidden from your view, or it just may be hard to get to. Where does all of the ICD-10 data in Tracks come from? Well, it comes through your interface from your practice management, your EHR system. And these ICD-10 codes can be found in your library of diagnosis codes, like the one that you see here. Here you can see that our diagnosis library stores both ICD-9 and ICD-10 codes. And you can easily view and switch between the 9 and 10 code sets. You'll see this library anytime that you need to select a diagnosis code, like when you create a patient search or a report or a dashboard and so on. The beauty about this library is that you can see the number of occurrences and when it was last used. And this information is so very helpful, especially because now you're looking at 69,000 ICD-10 codes. So now you could always know exactly which codes you need to include, because those are the ones that show that those are the ones that are being used. And you're also going to see ICD-10 codes assigned to patient visits. And you're going to begin to see these ICD-10 codes as you begin posting encounters with ICD-10 codes into your EHR. The next piece of the puzzle is preparing your i2i Tracks for ICD-10 compliance. It's really important to take a good look at where you've used ICD-9 codes. Perhaps you use ICD-9 codes in patient searches, in linked visit types, in patient problems, in reports and dashboards, PopIQ, maybe some other setup configurations. Or if you're like most of our clients, you use ICD-9 codes for all of these items. But how do you even know what you use ICD-9 codes for? Well, using your external data diagnostics tool, you have a window into the world of your ICD codes. You can see which ICD-9 codes you've used, the number of occurrences, the patient count, and you can view how your ICD-9 codes have been mapped in Tracks. Let's take a look. In this example, you can see my codes in the order of the most frequently used ICD-9 codes. and you can see just how and where you're using that code in tracks. I can see that I've mapped my heart disease here, which is ICD-10 402.00, to a few population analytic report items, to a linked visit type, to PopIQ, to the UDS tables. You could even use the filter option up at the top to limit your list to show those ICD-9s that you've assigned to reports or problems, or the ones that are used the most often. And now that you've identified what codes are used and how they're mapped, the thought of updating these items to be ICD-10 compliant will seem absolutely overwhelming. You may have hundreds of codes that are going to need updating. So before you pull out your hair, I'd like to share with you just a few tools that are going to help you as you go through this process. The crosswalk and the i2i Tracks Code Converter tools are a big help and will assist you to make a rapid transition. The first tool that brings relief is our built-in crosswalk. This crosswalk can be utilized to identify and select corresponding ICD-9s to ICD-10 codes. The crosswalk can be found anywhere in tracks that you have to select a diagnosis code. Just select your ICD-9 code and you'll see the equivalent ICD-10 code on the right side of your screen. You can select both codes at the same time if you want to. Remember that crosswalks can give you recommendations on equivalent codes, and many codes are very easy to crosswalk. But like Shannon said, ICD-10 codes can become more complicated with additional specificity, like going out to that 7th digit for episode of care or have an X as a placeholder. So when building new reports, it's always a good practice to search for additional ICD-10 codes that may also be appropriate matches. The second tool to help you with compliance is our new Code Converter tool, which will automate some of that tedious process of manually assigning ICD-10s everywhere that there's an ICD-9 code. And this really minimizes that manual chore of remapping. And it's called the ICD10 Automapping tool. This Code Converter tool will search through your i2i Tracks database and locate every report, every patient search, every problem, every dashboard, every linked visit type, everything to locate where you've used ICD-9 codes. Then i2i Tracks will use the ICD-9 to ICD-10 crosswalk to find the code matches and automatically update those items and add the equivalent ICD-10 codes for you. And after the converter tool runs, you're going to get a report that looks like the one you see here that lists all of the mapping additions. In our testing, these tools have updated hundreds and hundreds of items within minutes. And of course, it's a good practice to review the report and verify the new mappings and determine if there's any additional ICD-10 codes that you'll want to manually map. But this converter tool is going to save you an immense amount of time and effort. The next piece of the puzzle is daily monitoring of your ICD-10 usage. To be successful, you're going to need visibility to what codes are being used from day one. Just how are your providers doing with the change? Who's developing the good coding habits and who still needs more training? With our monitoring tools, you can make sure that you know exactly what is going on at your organization. You won't have to wait until the end of the month or until you start getting those denials. You'll know that you're doing it right from the beginning. And i2i Tracks has two tools to help you monitor your ICD-10 usage: the new Activity Diagnosis Report and the External Data Diagnostics tool. The new Diagnosis Activity Report is a feature that was designed to provide transparency of your coding practices. You'll be able to identify potential issues, see what providers could benefit with some some more training, stop the poor coding habit, and really compare your top ICD-10s to your top ICD-9s. This report can be separated by rendering location, by provider, or even by payer for any date range that you want. You could limit the report to the top 50, top 100, 200, 1,000 codes used. The idea is that at the end of day one, you'll know exactly if you have cause for alarm or if you can sleep well. When you look at the results, you can see the ICD-10 code and the description, the number of occurrences, and based on the crosswalk, the old equivalent ICD-9 code. When there are questionable diagnoses, you can drill down on any number and get a list of visits where ICD-10 codes were posted. Are providers posting accurately? Are they using the appropriate specificity? Your coders could use this information to see who's developing habits that need addressing right away. You can also use the external data diagnostics tool to monitor your ICD-10 activity. When you open the ICDs tab, you can filter on the code type and select ICD-10s only. Here you can see an overall view of ICD-10 usage. Compare your frequently used 10s to your frequently used 9s. Are they similar? Are you seeing disparities or gaps? And when you see a questionable code, you can drill down to that patient level detail and see what patient it was assigned to and who entered it. So every single day, you could be crystal clear what ICD-10s are being used in your system, who's using them, how often they're being used, and more. Having these two daily monitoring tools available at your fingertips will greatly increase your success during your ICD-10 transition. The ICD-10 tools to convert your mappings and to monitor your coding, they're available today in i2i Tracks version 11 of 7.4.5. So just open a support case and they'll send you instructions on how to get your upgrade. Once you are upgraded, just follow the documentation to guide you through the easy steps for using these tools. You won't be sorry, they're amazing. Also, make sure that you open a support case if you need any assistance with your interface or if you're not seeing in the ICD-10s in your i2i Tracks libraries. With i2i Tracks ICD-10 data, the compliance and daily monitoring tools, you can not only streamline your changeover from ICD-9 to ICD-10, but also attain rapid ICD-10 success throughout your organization. And we really look forward to continuous partnership with you during this important transition. Before we take your questions, I would like to share with you some upcoming learning opportunities. We have our registration open now for our upcoming training sessions. The next 2 courses are being held on the East Coast in Baltimore, Maryland. Just visit our website, i2isys.com, to register. And now we're going to take a minute and take some questions. And I've seen a few coming in here, so bear with me a second as I open the question panel here. The first question, Shannon, do you have any last-minute tips for educating providers or staff on ICD-10?
Sure. So your best bet right now is there are some webinars, probably, there are several webinars out there that are free. So if you're looking for some preparation prior to October 1st, I'd suggest reviewing those webinars. There's some good white papers out there. I would encourage everybody to set up a pretty aggressive chart auditing and monitoring mechanism for the next few months after we go live. To me, that's very critical. Even if you have the opportunity, which is probably not likely, And if you have been testing the ICD-10 codes and documentation over the past several weeks, then even to go back and do some one-on-one coaching and revisit how that coding looks in line with the documentation. But I would set up a pretty aggressive and continuous auditing and monitoring mechanism over the next several weeks. Don't let a whole lot of time go by, because you know, the more used to bad habits that our providers and our nurses and everybody else in our practice get used to, the harder it is to break. So that would be my best piece of advice, given that we're less than 24 hours, or about just over 24 hours away.
Great, thank you, Shannon. I've had a couple of questions on the code converter tool. One is, once you run the auto mapping tool, does it give you a report of what was mapped and what was not mapped? And there's actually a report that goes along with that. There's a report option right on that same screen, so you can print a hard copy for yourself, and it's really a good practice to review, because like I said, it's going to show you the matches between ICD-9 and ICD-10, but there are, you know, like I said, 60 some odd thousand ICD-10 codes, so there will be some that you will need to also add as well. The other question that came in says, in transforming, is there specific recommended step-by-step approach to changing out ICD-9s to ICD-10s, and should the ICD-10 mapping tool be used first to convert all the 9s used in reporting? And yes, absolutely, that's definitely the first step, is to run the auto mapping tool, because that's going to do most of the work for you. And what we've come to the conclusion in our beta testing sites is that it's probably a good idea to run the tool, and then for the next few weeks, as you're running reports and as you're running searches, to just verify the searches are using the appropriate ICD-9 and ICD-10 codes. And you're going to know what ICD-10 codes are being used by the external data diagnostics tool and the diagnosis activity report. So, the code converter tool is really your first step, and then the rest of the ICD-9 codes, really you could do on an as-needed basis, because the tool is going to find most of them for you. Let's see, and then the other question was, what is the version that these tools are in? And again, these tools are in version 11, so of 7.4.5. So it's tracks version 7.4.5.11. And just open a support case, and they will send you the instructions for how to update. It is ready and available today. The other question that came in was, what ICD-9 or 10 codes are in tracks? And I just wanted to make sure that you understand that when we bring in ICD-10 codes from your EHR, we're really mirroring their library. So when you look at i2i tracks ICD-10 library, it should be the same library that you're seeing in your ICD-10 library in your EHR. And if you're not seeing ICD-10 codes in tracks, please open a support case. We have modified our interfaces to accept ICD-10, but we are at the mercy of some of the vendors, the EHR vendors. So if you don't see them, please open a support case, and we will work with you and your vendor on that. And let me make sure there wasn't any other questions. Can we get a copy of the PowerPoint presentation? And absolutely, we've been recording the webinar, and we will email you the recording links with the presentation slides as well. And that's it for today's webinar. We'd like to thank you, and I want to thank Shannon for taking the time out of all of your schedules to attend today's workshop. And I guess that's all for today. For more information, please visit our website at i2isys.com. thank you for attending and have a wonderful, wonderful day.